peak time there, and we'd expect there to be a bit of a plateau. If you look what's happened in other countries, that's what they've seen. That's what we'd expect. You'd expect that to go on for 2 or 3 weeks, but I can't be absolutely sure on the time of that.
Would you like to follow up there, Andy? We're not hearing you. Okay, I'm afraid we'll have to move on to Martin Brown from the Daily Express.
Foreign Secretary, I just want to take you back to your opening remarks where you said our plan is working. But we've seen so far that testing has been slow. The government's frantically trying to get ventilators. Frontline NHS staff are still struggling to get hold of PPE, and some experts are predicting that Britain will have the worst death rate from coronavirus in Europe. So was this all part of the plan? And Sir Patrick and Professor Whitty, what specific evidence are you looking for, scientific evidence are you looking for to reopen schools? And do you think it would be wise that the UK follows the European example and opens schools so soon after their supposed peak?
So, Martin, the two crucial things in terms of, as we've always argued, flattening the peak and making sure the NHS can cope is, on the one hand, getting people to follow the guidelines about social distancing. They've showed the forbearance, the sacrifice, which has allowed us to deliver on that. It's been a national effort. A lot of people have, particularly when you think of the warm weather, people with young families, that's been a success. In terms of delivering on that side of things, and that has helped limit the spread. I know it's difficult when you look at the death toll and those figures, but we are seeing signs of tentative signs of a flattening out, and that was the original plan. The second thing is making sure that the NHS has got the capacity, indeed some headroom, whether it's critical care beds or the ventilators that can support those who need it. And on those two key aspects, and I'm not saying there haven't been challenges right across the range of different things that we've got to achieve, but on those two critical aspects, actually we've got ourselves into a good place, and so the key thing is to keep delivering on that plan.
In terms of timing of changes, I think it's really important that we're now at a stage when you can begin to see the flattening. We'll look and see where the peak is and when we are firmly the other side of it in terms of numbers coming down. Only at that stage do you start looking at what measures might be released and how they might be released. It would be a complete waste of everything that everyone's had to do till now, and I absolutely understand the difficulties that some of the decisions make, but it would be a waste if we were to rapidly reverse that and lead to a re-emergence of this. The key is to keep that R value below 1 and to see this on the way down. Once it gets above 1, you start to get this exponential growth again, which we cannot afford to have, nobody can, and therefore the timing of these decisions, including things around schools, will have to be taken in the light of evidence and data as it emerges.
And of course, if we took our foot off the pedal too early, if we eased up too early, we'd risk a second wave, and that would be particularly damaging and would, I think, even for businesses, some of whom are particularly concerned, have been asking for more clarity, I think would be particularly damaging for them. So we want to take the right decisions, as we've always said, at the right time. Would you like to come back on any of that?
If I may, just on the R value, actually, Sir Patrick, are we? How close are we to getting towards that? Are we nearer the 1 than 2, for example?
Well, I think, as I've said recently, I think in the community, you'd expect the R now to be below 1 in general. And we're going to review that again this week, but that's what you'd expect in the community. It doesn't mean overall it's below 1, because we know that there are cases in care homes and in hospitals where there's still infection being picked up. But in the community, with the distancing in place, the R is expected to be below 1.
Can I turn to Patrick Maguire from the New Statesman?
Good evening. Professor Whitty, you said that 1 in 10 care homes were infected last week. Have you any advance on that figure? Is it going up or is it going down? And how can you accurately model the spread, given that testing is so haphazard? And First Secretary, what sort of economic modelling have you done on the various lockdown exit scenarios?
Patrick, do you want to?
Should I do the care homes?
Chris, go ahead.
On care homes, so at the moment, the total number cumulatively across the whole country is around 13.5% overall. And in the last 24 hours, there have been 92 care homes where an outbreak has been detected. So that's a direct answer to your question. In terms of testing, of course, if an outbreak is suspected, then the public health authorities will go in and do testing to assess whether an outbreak has occurred. And that is going on all the time and has gone on through this. And that allows the care home staff, who are absolutely fantastic and are doing a very difficult job, for the benefit of the people who live with them. They can then isolate people who are symptomatic and try and make sure that this does not spread within the care home.
And Patrick, on your other question, we're looking at all the data, whether it's economic, health, social outcomes in relation to all of the measures that we've got in place. And indeed, when the time is right, we will look at them in terms of any changes we've made. But we're not there yet. And as I said, we want to keep the focus on maintaining the social distancing measures for all the reasons that I think have been backed up by Sir Patrick and Chris today. Would you like to come back on any of that?
Yes, just on the question of PPE in care homes, there have been complaints about cost from care homes. How are you ensuring that cost is no barrier for care homes in terms of them getting adequate PPE, and especially with the demands on hospitals, sort of how are you prioritising what goes where and at what cost?
Well, cost hasn't been the major challenge for us. It is supply, because it's a very competitive market out there, because there's so much demand for it. And also, I think particularly with care homes, some of the local distribution. So we've had last week one drop of bulk PPE to local resilience forums, and we've got another one this week. Just to be clear about what that means, it's a bulk drop to a group, a body, that can then make sure that they get to the individual local authorities and local care homes that really need them. We've set up a hotline, so when there are distribution challenges, and we recognise that there have been some, that they can be unblocked as quickly as possible. So we're doing everything we can, and I chaired a meeting this morning on it. It's something we're looking at a daily basis. We're doing everything we can to try and get the PPE where it's most needed. And I think we're on to Adam Bienkov from Business Insider, please.
This is a question both to the First Secretary of State and to the scientific and medical advisors. More than 11,000 people have died now in UK hospitals after contracting the coronavirus. And one of the government's own scientific advisors, Jeremy Farrar, said yesterday that the UK is, of course, being one of the worst, if not the worst, affected country in Europe. Does the government now accept that it should have acted soon in locking down the country? And in hindsight, does the scientific and medical advisors believe that they should have pushed harder for the government to make that decision earlier? And if they had have done so, could lives that have been lost have now been saved?
Well, I'm going to defer to the scientific and medical experts. I'm not sure, though, that that is comparing like with like, either on the data that we've got or the other underlying data that we've been looking at. Patrick, would you like to address that further?
The aim all along, and clearly Sir Jeremy Farrar has been part of the group, has been to get the numbers down, make sure that we keep the numbers below NHS capacity, and ensure, therefore, that the NHS can function. And that has been an absolute aim in this. And so far, that is exactly where we are in terms of keeping this under control, with heroic efforts from the NHS, including increasing capacity, and the superhuman efforts of the doctors and nurses and all the others who look after the patients. The direct comparison around things, I think we need to wait and see how things evolve. There's a long way to go yet in this disease. It's still a new disease. It still hasn't spread everywhere across the world. It still hasn't actually been allowed to be released from places that have got locked down. So I think we've got a lot yet to see in terms of where this ends up. Clearly, it's going to be very important that we concentrate on things like vaccine and therapeutics to get there. I think the measures that we've got in place are holding it in the right position in terms of keeping numbers down and NHS capacity at the moment.
Adam, did you want to come back on any of that?
Well, I accept that you cannot always make direct comparisons between countries. I think if you look at some of the countries that acted much sooner than the UK, South Korea in particular, only had a fraction of the deaths that we've seen in the UK. Isn't it clear that had we acted sooner, days or even weeks earlier than we did, that it would have made a difference in terms of lives lost?
I don't think it is clear. I don't think those comparisons are like for like because of A, where we are on the curve, as Sir Patrick has mentioned, but also the individual circumstance in those countries. But we will continue to monitor, and we do monitor what's going on in other countries and make sure we feed that into what we're doing here. Patrick, I don't know if there's anything else you'd add to that.
No, I think it's very difficult to make those comparisons, and as I say, we'll be able to look and see this in due course. I think there's a lot to learn from other countries in terms of what we need to do, and we're definitely looking very closely at other countries in terms of how they think about release of lockdown measures.
Thanks, Adam. Thank you all very much.